Welcome back. We are committed to you here at Fox Carolina, and we're looking into a new warning from doctors about an unapproved COVID-19 treatment. Doctors say they are getting more and more calls and misinformation and circulating online thanks to social media about a medication. It's most commonly used to treat horses, to get rid of parasites. I dewormed my horses with this when I used to college rodeo. It's crazy people are putting this stuff in their mouth, but now experts say people are trying to use it to cure COVID-19. So why do some people now believe that, and why are they using it, and why is it dangerous? Matt Koufax started getting those answers this afternoon, and he has those tonight. And Matt, it's just crazy because, again, we used to deworm our horses with this, and it's crazy people think it's going to work to treat COVID.
Cody, I'm not sure how many people have horse parasites. This is one of the more bizarre stories that we've covered. Nevertheless, this is a treatment that some people are thinking is okay to use. Now, Ivermectin, you're about to see a picture of it on your screen. It can be used in humans in rarer instances, and we don't see it a lot in the States because of our cleaner food and drinking water resources. Experts tell me that it's a variety of sources that are perpetuating this misinformation, and people need to stop buying into it. Dr. Jill Michaels with the Palmetto Poison Center says they've received a handful of calls about ivermectin related to it being a possible treatment for COVID. It's something she says concerns her.
To me, as a pharmacist, there's misinformation out there.
She says it comes from a variety of places, most notably social media, but the idea is not proven.
Right now, I'd say it's inconclusive, and for people to try this on their own, it's a very unsafe, unhealthy thing to do.
She says there are studies being done on ivermectin right now to see whether it can reduce COVID replication.
You know, they sometimes do studies on just cells, specific to cells, what we call in vitro.
But the only data they have is from clusters of cells, not even actual humans. And it's mostly used in vet medicine for horses in the U.S.
This is a medication, and it can interact with other medications.
Michael says people hearing from their neighbor or from Facebook and then trying this are setting themselves up for disaster.
You're trying to guess a dose based on what they're treating a horse for. The dose could be way high.
She says reactions can range from upset stomach and rash all the way to seizures and comas in the case of an overdose.
People do not surprise me these days. Not at all.
Mallory Hulling says she hasn't seen anything on ivermectin herself, but doesn't think it's a good idea at all and has a message for those thinking of trying it.
I thought it was pretty crazy. I don't foresee myself ever walking down the street and saying, oh, there's a liquid in a syringe. Let me see what that does to me. Save it for the horses.
Probably wise words there. And ivermectin, maybe not the greatest thing to use right now, especially with it being so unproven. Dr. Michael says that don't listen to that person who maybe says they do a lot of internet research, that's your across the street neighbor or on Facebook. She says in order to get to the heart of these things, go to your doctor, go to a local pharmacist, go to someone in your community that you trust who's going to understand the medical research behind this and can give it to you straight. Cody, Tori, back to you.
All right, Matt, thank you.